Can I safely use this medication after having my gallbladder removed? Tirzepatide can be safely used after gallbladder removal, as cholecystectomy is not a contraindication and doesn't affect the medication's function. If you've had your gallbladder removed and you're wondering whether tirzepatide is right for you, this video will walk you through what you need to know. But remember, this is educational information only, not medical advice. Always speak with your healthcare professional before starting, stopping, or changing any medication. Tirzepatide, which you might know as Mounjaro or Zepbound, is FDA approved for managing type 2 diabetes and for chronic weight management in adults with obesity or overweight with related health conditions. And here's the good news. Having your gallbladder removed doesn't mean you can't use it. Let me explain why. Tirzepatide is a dual GIP and GLP-1 receptor agonist. That means it works by enhancing insulin secretion, suppressing glucagon release, slowing how quickly your stomach empties, and reducing appetite through pathways in your central nervous system. Importantly, it doesn't depend on your gallbladder or bile function to work. This medication is given as a subcutaneous injection when prescribed, and it's broken down through a process called proteolytic degradation. Your gallbladder isn't involved in that process at all. The FDA prescribing information for tirzepatide doesn't list gallbladder removal as a contraindication or even as a precaution. So from a medical standpoint, cholecystectomy doesn't affect how the medication is absorbed or how well it works. Now let's talk about digestion. Your gallbladder normally stores bile from your liver and releases it when you eat fatty foods to help with digestion. After gallbladder removal, bile flows continuously from your liver directly into your small intestine instead of being stored and released on demand. Some people experience digestive changes after this surgery, which is completely normal. Tirzepatide also affects digestion by slowing gastric emptying. That's actually part of how it works. So you might be wondering if both gallbladder removal and tirzepatide affect digestion, will combining them cause problems? Here's what you should know. Tirzepatide commonly causes gastrointestinal side effects like nausea, diarrhea, and abdominal discomfort. These are the most frequently reported side effects. If you've had your gallbladder removed, you might already experience some digestive changes, and these could overlap with tirzepatide's side effects. The good news is that for most people, these gastrointestinal side effects typically improve within 4 to 8 weeks as your body adjusts to the medication. If you're considering tirzepatide after gallbladder removal, here's what to discuss with your healthcare provider. This is a prescription medication, and it's not right for everyone. Your doctor will need to review your complete medical history, including any personal or family history of medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2, as tirzepatide is not appropriate for people with these conditions. Your prescriber will start you at a lower dose and may adjust it gradually based on your response and how well you tolerate it. This gradual approach helps minimize side effects. Your healthcare provider might want to monitor you more closely, especially in the beginning, to see how you're responding. They can help you develop strategies to manage any digestive symptoms that come up. Speaking of managing side effects, there are practical steps you can take. Eating smaller, more frequent meals can help. Avoiding high-fat foods may reduce digestive discomfort, especially since your body processes fats differently without a gallbladder. Staying well hydrated is important, particularly if you experience nausea or diarrhea. Now let's talk about when you need to contact your doctor. You should reach out immediately if you experience severe abdominal pain, persistent vomiting, signs of dehydration like decreased urination or extreme thirst, or jaundice, which is yellowing of your skin or eyes. These could indicate complications that need prompt medical attention. It's also worth mentioning that while the specific risks of gallstones and gallbladder inflammation don't apply after gallbladder removal, other biliary tract issues can still occur. That's why it's important to seek medical care for any severe or persistent abdominal symptoms. Here's what you need to remember. Tirzepatide can be safely used after gallbladder removal because the surgery doesn't affect how the medication works. You may experience some overlapping digestive symptoms, but these typically improve with time and can be managed with practical strategies. And as always, work closely with your healthcare provider to monitor your response and adjust your treatment plan as needed. Every person's situation is unique, so what works for someone else might not be exactly right for you. That's why it's essential to have an open conversation with your doctor about your medical history, including your gallbladder removal, before starting tirzepatide. Never change your medication plan without professional guidance. Have you had your gallbladder removed and used Tirzepatide? Drop a comment below and share your experience. And if you found this helpful, give us a like and subscribe for more evidence-based health information.